Welcome to Deuk Spine Institute. We are broadcasting spine surgery live. Our patient has just had the Deuk laser disc repair. We fixed 3 discs. We now just treated the SI joint. She has sacroiliitis. That's finished. And we're getting ready to treat her piriformis muscle. Piriformis syndrome is basically a condition where the muscle that runs here, called the piriformis muscle, it's a fan-shaped muscle called piriformis, has a tear. And the tear happens when people bend improperly and bend and twist their hips. And the reason you get a tear is because, number one, you're deconditioned, your muscle's weak, and you're not bending properly because you're having back pain from your disc problem. So when you don't treat the disc pain in your back, you start bending bad, twisting bad, you have bad what we call body biomechanics. You end up tearing the piriformis muscle. The pain never goes away from a piriformis tear. There's only one way to fix it, and that is to release the muscle. Traditional piriformis release requires a big incision like this, and the surgeons will cut through all the skin and fat and then get into the gluteus maximus, which you don't want to cut your gluteus maximus. That's the one that gives you a nice shape. It's your main muscle, but they cut right through it to get to the piriformis below, and then there's a sciatic nerve that comes out of there and runs down your leg. Dangerous, bad surgery. So I pioneered a new technique where you just go off to the side and you basically release the muscle tendon right off the top of the hip, and that's what we're going to do. Let's bring in the fluoro. If you have questions, feel free to ask. We don't have a video yet for this. We're going to have a video for this surgery next. This will be one of our last videos, and then we'll start on the hip and the knee and the shoulder. All right. Shot? Is that it? No. Let's get in position. All right. There we go. So there you can actually see the piriformis muscle in that picture. Let me pull this off. Shot? No. That's you like that, Jordan? If you like it, we'll stay there. But I think you should go north just a smidgen. Sean? All right, Jordan, show us the piriformis muscle. You can see it. My gosh, you can see it nicely. Right there. That's the top border, and there's the bottom border. It runs from the top of the hip right over to the tailbone. Now, I discovered this technique, pioneered it, based on shot studies, anatomy, and anatomical studies. And I realized that there's a very easy way to fix this problem, and that is to just go to the top of the hip. It's safe. There's really nothing there we can damage right through this approach. And we pioneered this approach here at Deuk Spine Institute because we have so many people with problems with their piriformis. And we realized, my gosh, all these people have bad piriformis problems, and they're still having pain after our beautiful laser surgery on the disc. So what can we do to fix that? And we realized this is the way to do it. So we started doing these surgeries, and lo and behold, we were able to cure their pain with this procedure. All right, we're going to get started. If you have any questions, feel free to ask me. I'm happy to answer them for you. In the meantime, we're going to release the piriformis muscle right now and get rid of her piriformis pain. Any questions?
At this moment, no current questions.
I use the X-ray to guide my release. Oh yeah, I felt that one. That was a good one. Really good one. How you doing there? Your sinuses bothering you? Allergies?
Yeah, allergies.
Is it?
Yeah.
What is it?
I don't know.
Viral?
Yeah.
Because I'm dying. Like my allergies are so bad, I had to start Sudafed. Yeah. Huh? Right? All right. So you too. It's not just me. All right. You too. I'm feeling better already. All right, we're just about done. The piriformis release is another 10 seconds and we're done. Oh, I want a patella here. Oh well.
We have a question
Yes.
coming from Adam on YouTube
Yes, Adam.
asking, can cervical stenosis cause pins and needles in the face and lower limbs?
No. Generally not. Generally, cervical stenosis will cause numbness, tingling in your hands, weakness in your hands, clumsiness of the hands, balance problems, and trouble controlling your bladder. It rarely affects the legs, and I mean, it can cause some facial stuff, but it's extremely rare. That's not my first diagnosis. We're done. She's going to do amazing. She came here from the villages, and we did 3 different types of procedures, and we're finished. She's going to go home in an hour, and that pain she's had for 35 years will be gone. Really happy for her. We're going to be back shortly. We have another patient. This next patient's having neck pain from facet joints. We're going to do a cervical Deuk plasma rhizotomy, and then we're going to do bilateral sacroiliac joints, just like we just did a few minutes ago. And so if you missed the SI joint Deuk plasma rhizotomy, come back and join us. You'll be able to see hers.